Oh, this is depressing.
I'm depressed. I didn't get the tickets I wanted.
Ah, the weather is so depressing today.
What's the difference between what they're experiencing and clinical depression? In this course, you'll find out. By some estimates, clinical depression is the #1 cause of disability in Western cultures. Beyond cancer, beyond HIV/AIDS, beyond stroke, beyond anything. And its cost in economic terms is exceeded by its cost in human suffering. I'm Randy Patterson, a psychologist in Vancouver, Canada. I've been treating depression now for almost 30 years in hospital and outpatient settings, and I'm the lead author of Canada's most widely used group therapy protocol for depression. In my workshop programs, I've taught thousands of therapists how to recognize and understand depression. And in this course, I'll teach you about it too. The course is called What is Depression? And that title is important. I'm not going to range over the entire field of depression in one short course. Instead, I'm going to focus on the nature of depression, the symptoms, the subtypes, and how depression is diagnosed. In this course, I do not cover the causes of depression, and I don't focus on treatment. I'm leaving those for other courses. This program is just, what is it? And I hope that you'll find that it's a little bit more in-depth than you often see. Despite that detail, though, I have to caution you. The course is not a substitute for professional care. Depression has to be carefully looked at, partly because many other problems can masquerade as clinical depression. You cannot use this course to diagnose yourself or anyone around you. What it may do is describe the experience of depression in a way that you can recognize. There are 12 lectures in all. I'll start out by distinguishing between depression and everyday blues. Then I'll show you the floating diamond model for classifying depression symptoms. I'll spend 2 lectures reviewing the symptoms used in diagnosing the most common mood problem, major depressive episode. And we'll look at the additional criteria that define major depressive disorder. But you know, the diagnostic label doesn't really cover the full experience of depression. There are additional symptoms that do not appear in it. So I'll tell you about those. And then we'll consider some other types of mood problem. We'll ask whether there's such a thing as minor depression. And we'll look at persistent depressive disorder, also known as dysthymia. I'll talk about bipolar disorder and cyclothymia. And along the way, I'll touch on some of the controversies in the field. Defining the ways that life can become overwhelming is surprisingly difficult, and professionals fight about these issues all the time. I'll show you some of the gray zones. And finally, I'll briefly discuss the epidemiology of depression. How common is it? Who gets it? Do women really become depressed more often than men do? And what's the most likely age of first onset? Oh, and how much does this problem cost us really? As you consider taking this course, you might wonder, am I going to tell you things that you couldn't find out elsewhere if you looked hard enough? Well, actually, I don't think so. But I hope that I've presented it clearly enough, in enough detail, that it will be useful information for you. And you'll get a handout package summarizing the content of each lecture. Do remember, though, this is not treatment, and I am not going to tell you very much about how depression is treated. So this course is a snapshot. What are the mood disorders? If you want to find out more, I'll see you inside the course.
you.